purchase motorcycles, you know, go on vacations and all this other stuff, have enough money to spend maybe $20 a month for healthcare or $100 a month for healthcare.
Right. So I think, of course, just estimate.
Yeah,
but
estimate,
we
sure.
can,
yeah, I mean, you know
we can
so
see
much,
the
but
statistic.
yeah, you know much.
Yeah. So for the rich, actually around 20% of the population are rich, around 20%. So they can, you know, maybe send his child to overseas around 20%. So 20% times 260 million. So it is also huge number.
Right.
For example, 20 times 250, for example, like 50 million. So 50 million is almost similar 10 times of the population of Singapore.
Right.
Something like that.
Right. Exactly.
So then around actually in the middle is around, so middle income earner and less than 20%. This is around 30%. 30%. And then the middle income and the poor actually by statistic is only 11.5%, but reality is around 50%.
Right.
But
That's my sense too.
Yeah. This statistic is a little bit different with my sense.
Yeah.
But it is real, because why the government then pay for 92 million people if, you know,
Right.
they're able to pay.
Right. But why does the government charge only that low amount for those people who can go overseas and buy 4 or 5 cars or whatever?
That is very difficult, and I have also again my personal opinion and personal experience, because that time we are facing with what you call it, association of companies and commercial, what you call it, commercial association. So they are rich and they are very strong. So when we say, okay, the rich have to pay more, and they said no. And the big companies have very good, power to influence the government. Actually, so that is the problem. Especially, they said, okay, if high salary employees of the company should pay huge amount of money, then our company will collapse. They said like that. So, and then the government, okay. So it's something like that. So, because it cannot be determined only Minister of Health, but other ministry. So, Ministry of Finance, Ministry of Enterprises.
So this is my question. Been here for 18 years, so I learned a lot about this political system in the U.S. with this Affordable Care Act, right, of what you said, Obamacare. So now go back to Indonesia. I just like to know, is there any political parties in Indonesia that their platform is trying to expand this healthcare system, or any other political parties on the other side try to reduce this? What is the dynamic of political system in Indonesia in terms of healthcare?
Yeah, it is very difficult. Although now is the health is interesting for the political parties, political debate, but those who really know the real problems and how to sell it, it is not quite strong. But I hope that this coming national election and also the local election, there will be the issue, I hope.
In regional level.
In regional level, yeah.
In Aceh, we have Jika, Aceh, which cover everyone who has an ID card, like an Aceh, they have it. But I don't know other part of Indonesia.
Yeah, now it's increasing the awareness that the health issue is important in elections. It's very increasing, but not as like in US where the debate then Obama, Republican and the Democrats like that.
So we had a question back here. Yes.
Hey, Dr. Ali, Benjamin from the Philippines and from the School of Recognized Australia.
I thought you're from Indonesia.
My question is about, I think you mentioned summary of presentation that doctors are complaining about,
Yes.
the professional fees not being adequately covered by the insurance. And kind of the Philippines are encountering this same situation as well. PhilHealth is not able to fully cover for the PFs, and physicians, health workers, they think they need to charge more. They want to sell police even their own professional fees. So how are you negotiating that with like the medical association? Because like it basically opens doors for like, let's say under the table, payments we're seeing that in the Philippines, apart from what PhilHealth is, paying for professional fee, the doctor in the bedside charges additional fees again because PhilHealth doesn't cover what the doctor thinks is his total
Yeah, of course, for the negotiation, now the negotiation is between health insurance carrier or PhilHealth Corporation in Philippines and the association of medical association and hospital association. So they can meet, but of course the government also there. So sometimes deadlock because you cannot negotiate properly. So then government decided. But in this case, of course, the hospital association and medical association is loose in current situation. So they want more, but again they can't because again BPJS is already deficit. So BPJS do not want to pay more. So now the medical association just 2 days ago they meet and they write the complaints. So all the complaints write down by the Indonesian Medical Association, and they said this to the public. So they are really not satisfied and they want change. So I can see what they are.
Michael first.
I wonder if you could say something about the current ministry that you're in, the research agenda, and how that interfaces with healthcare, if at all. I mean, is there a research component, first of all, in doing what we call translational medicine, trying to get new therapies widely disseminated? Or in one of the early slides, you had a very interesting slide, which from a Singapore point of view is quite odd, in that you had a circle for reform of the universities, and then there was culture, and then there was economic growth.
Right.
Singapore doesn't have the central circle, it just has economic growth. So I'm very interested in the university reform, what's being done in medical schools in order to create a higher quality medical cadre, more technology that is distributive rather than just high-end technology. I wonder if that's part of your portfolio at this point.
Could you
Yes.
mostly hear the question? Okay.
Yes, it is part of my portfolio because now we have shared problems with Ministry of Health.
Right.
So under the Ministry of Research, Technology and Higher Education, there are 24 teaching hospitals where the teaching hospital have to, doing research and finding new technologies and then tested it and then of course can be developed. And I was assigned, now I'm assigned to, as the chairman of the joint committee between Ministry of Health and Ministry of Ministry of Research, Technology and Higher Education. So now we are developing what we call it academic health system. So academic health system where the medical faculty or school of medicine have to join together with the teaching hospital and local hospital. So they together not only introducing reform in medical school, for example, interprofessional education approach should be introduced. Then also they have to what is the Ministry of Health target, for example, that each new general practitioners have to be able to diagnose 155, so that now reform the content of the curriculum and the outcomes of the teaching learning in the Faculty of Medicine. Of course, then now not only the curriculum and also the learning outcomes, but also the way to the process. For example, after finishing medical school, they have to take national exam. National exam, if they finish, they have to go to internship to the across the country. They can choose for 1 year, and then after that, now we opening just started primary care study program, so they can continue as the primary care physician to enter again schooling for around 2 or 3 years. It is the new in Indonesia.